Welcome to Samba Samba. Enjoy the video.
You start by measuring where you are and removing barriers to care. Use a simple acuity chart or app to record distance and near vision so you can track improvement. This is how you quantify progress. Once done, list medications, allergies, and any recent trauma or fluctuating blood sugar that could affect eyes. Make sure to book a professional eye exam within 48 hours. Immediate triage rules out emergencies and directs the correct path forward. You continue with targeted interventions the specialist prescribes because vision responds variably to different treatments. Start any medicated eye drops, oral meds, or patching exactly as instructed. Precise timing and dosing influence healing. Once on a baseline, add vision therapy exercises daily, short, deliberate sessions that strengthen focusing and eye movement, log sets and reps to judge progress. If vision stabilizes without improvement, make sure to discuss. You finish by consolidating results and deciding next steps. Reassess objectively at 4 to 8 weeks, comparing acuity records and symptom notes to see measured change. Once done, determine whether to continue, modify, or escalate care. Seek a second opinion or imaging if gains are absent. Make sure to recognize red flags. Sudden severe pain or rapid vision loss requires emergency care, while persistent haze or inflammation may need medication adjustment. If problems occur, call your provider immediately to avoid lasting damage.
Thanks for watching. Consider subscribing if we helped you.